Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral health, and do subscribe to our YouTube channel. Join our other social media network like the Facebook, Twitter, and Telegram to get your everyday updates. And in conversation with me today on the Tooth Talk is Dr. Ranjani Rao. To give you a brief introduction about Dr. Ranjani Rao is a graduate from the prestigious RV Dental College from Bangalore. She graduated in the year 2000 and has a rich clinical experience of 19 years in the field. She has an MPhil in Hospital and Health Management from BITS Pilani with a fellowship in orthodontics and surgery and a mastership in implant dentistry. Dr. Rao is passionate about implant and aesthetic dentistry. Dr. Ranjani, along with Dr. Hema Ahuja, manages two state-of-the-art dental practices in Electronic City, Bangalore. Dr. Ranjani, thank you so much for joining me in today's conversation.
Thank you. Pleasure is all mine. So nice to be back, Dr. Rekha.
So, I think in a couple of earlier sessions, we did talk about tooth decay. How decay happens and how the patients themselves, to an extent, can try to identify if they have a decay, or how they can go to their dentist for a checkup, and their dentist will recognize and identify a tooth decay if it is developing. So what happens after this? After a tooth decay has been identified in a patient's mouth?
So, treatment. So, once we've diagnosed that a tooth or a couple of teeth have decay, then how do we treat it? So, treatment is usually in common terms referred to as a filling or a restoration. So, basically, which is restoring that portion of the tooth that is destroyed by the decay. How do you restore? There are several options. The most common one that most of us are aware of today is a tooth-colored filling material called composite. Okay. Now, however, this isn't the only option. There are different options. Your dentist is the best judge on which restoration is suitable for which tooth and in which surface of the tooth. So, in the same patient, a doctor may decide to give a composite filling in one tooth, may resort to a slightly different restoration like an inlay or a metal crown in another tooth. So it's not a one solution for all problem kind of a thing. Each tooth has to be assessed, the extent of decay, the location of the decay, and then a filling is suggested, composite being the most common. In children, we use a material called glass ionomer cement. So your doctor would refer to it as GIC. It's a short form for it. That is a favorite for children because it also contains some amount of fluoride that is released into the tooth once the restoration is placed. This protects the tooth from future decay. So that's why we prefer to use that in children. In adults, there are certain situations where glass ionomer becomes your treatment of choice, especially elderly patients showing caries in the gingival region. Yes. Sometimes very deep cavities require a layer of GIC and then composite. So that's technically called a sandwich technique. So your doctor may be using these terms. Please understand that each is different from the other. There is a lot of skill involved, and there are specific indications for each of these materials. Yes. To the extent that gold still remains one of the best tooth filling materials, if you can afford it.
Well, I think considering most people would like to have more aesthetic filling, like the way we call it, more tooth color, because I think nobody wants anybody to know that they have a filling in their mouth. Otherwise, I think till so many years ago, I think again silver fillings were the fillings of choice, and most of the teeth were restored. And of course, silver fillings last a very long time. I mean, easily 1 to 2 decades. People have had fillings which are that long in terms of strength. So I think we do have patients who come and ask us the difference between a silver filling and what we call as an aesthetic filling that we do today, which is a tooth colored filling. So, what do you think in terms of the durability or the strength of the material goes?
Okay, Dr. Rekha, this is a very common question that gets asked. Doc, I have a silver filling that was done when I was a child, 15, 18 years ago. But it doesn't bother me. Do I need to remove it? I want people to understand silver amalgam on its own is extremely hard. In fact, it is about 9.5 times harder than your own tooth. Even. So what happens is your filling will never get damaged. But because the elasticity of the tooth and that of the filling is different, you will notice that the margins around the filling will start ditching. That is the weaker point. So then food and all of that is seeping through. Bacteria is going under your filling and causing secondary decay. So typically you'll find that somebody with an old silver filling, when you take it out, there's actually decay underneath. So then it's not serving our purpose at all. So silver filling is a good material to use when the tooth is already endodontically treated and then we want to cover the tooth. It still is a good material of choice. Even though personally, I prefer resin reinforced materials because I find them to be having a similar elasticity as the tooth. So we need to keep the material as close to the natural tooth structure as possible for it to last longer and do good to the tooth. So silver is, of course, silver and black in color.
Yes.
Aesthetic restoration. Now, the way they work is silver just works by making a small pit and you just fill the pit in. Whereas composite works because it reacts with the calcium in your tooth structure and actually forms a bond. Yeah. The advantage of doing that is you don't have to drill too much into a cavity. Okay, you just need to remove the decayed layer. If the decayed layer is just say 2.5 millimeters, that's enough. We don't need to go in and prepare a big cavity. Yes. So we call this as atraumatic restorative therapy. That is what the whole world of dentistry is heading towards. How much of tooth structure can be saved? How much of minimal drilling? So this is good news to our patients. So we don't want to drill too much. We would like to bring down the drilling to as minimum as possible. Yes.
The amount of tooth material that we have to remove for a restoration is has to be reduced as much as possible so that the strength, what is the strength of the natural tooth is retained.
Retained, yes, yes.
Okay, so what other than filling materials in the sense like typically that what we call as we prepare a cavity or remove the tooth decay and then we restore it or fill it with a material, that is one type of restoration or a filling that we call. What sometimes this kind of a filling may not be possible in some patients. In those cases, what are the other options they would have to restore a tooth?
Yes. See, some of the challenging areas in your tooth are when the cavity is between two teeth. So we call them as proximal decay, which means the point of contact between two teeth, decay starts developing there, which means the contact wall gets broken. So we have to restore that contact wall, which is quite a challenge because eating habits of the patient, if the patient is a very strong chewer, meat eater, then we have to keep in mind that there's always going to be all kinds of, forces at different angles, and the filling has to withstand all that. Then we may suggest that we can do what is known as an inlay or an onlay. So what's the difference? Here, the filling is prepared outside the mouth in a lab. Molten metal is flown into a die, and the exact shape and size of the cavity filling material is prepared. So you get a ready-made filling, which is then seated into the tooth and cemented to the tooth. So that's called an inlay. Since this procedure is done outside in the lab, accuracy, you can polish it well, you can make sure that the walls are designed properly. A lot of inputs because, accessibility and visibility is quite a challenge inside the mouth. However, in the lab, we have the freedom to, make it. Also, we're going to be using an alloy of stainless steel or we use zirconia. Again, we can make it aesthetic. We can make it tooth colored too. So you get zirconia inlays. In fact, we've gone ahead today. There's enough technology that tells you We can even use zirconia for people with grinding, if they have a night grinding habit, and when tooth colored fillings were contraindicated for them.
Yes.
Today we have Bruxo. It's a brilliant brand, can be used. We can actually use it to make crowns as well as fillings for people who have a habit of grinding their teeth at night. So inlays are an amazing option when the proximal wall is broken, if there's a gap between the teeth, if the cavity is way too big. I also want to add here that giving a crown is also a form of restoration. So
Yes.
I've had a lot of patients who said, Doc, I ran away from the previous dentist because he told me for a decay I have to get a crown. So I want them to understand it is a choice. Okay, if the decay is covering more than 3 walls of the tooth, but it's not gone deeper, restoration is a challenge. So then
Yes.
it's better to give a crown, protect the tooth, and the patient can go ahead and use it to chew, grind, eat for a very long time.
Yes.
It shouldn't be an issue.
Also, Dr. Ranjani, I think one of the most common questions patients ask us before they get a treatment procedure like a filling done is, Doctor, is this filling going to be permanent for me? So, what is your take on the term permanent?
Yeah. I know how everybody wants to enter a dentist's office once and think that's it. They've done it for lifetime. They've paid their dues to a dentist. There's nothing in this world that is permanent. These fillings are meant to last long, but remember, they're in a very hostile environment called your mouth. There's a whole battalion of bacteria. There's a whole lot of acid, food, all kinds of activities that is happening. And there is no way I can predict what your oral environment is going to be like 10 years from now. Okay. So unless the environment continues to remain the same and the patient is maintaining it well, the filling can last, given that the conditions continue to remain the same. There are hormonal changes, there are dietary changes. Patient could actually fall sick, patient could develop diabetes, patient can undergo a period of illness where the acidity and the alkalinity of the saliva may change. So there are 100 different factors which could result. Patient could end up biting on something hard. And so I would like to believe that these fillings are long lasting, but they are not permanent. You have to visit your dentist every 6 months, get those fillings checked, see if they are in proper condition, see if they need any kind of modification, repolishing. Make sure that you're doing your hygiene part, flossing, oral irrigation, brushing 2 times a day. It requires maintenance. Even when you buy the most expensive car in the world, it requires maintenance, right? It's not that because you paid a huge sum of money, you don't need to take the car back to the garage at all. So I usually use the same analogy with my patients, and I see their eyes brighten up. But that's a fact. So whatever we've given you is artificial, as close to nature as possible. We are artists. We've done a pretty decent job, but it requires maintenance. A little effort from your side and a little care from your dentist too.
Exactly. So I think that was hopefully that was very informative to our patients. Oh yes, of course. Before that, I think the one thing is, of course, the patients do ask us about the permanence of the filling, and I think there is another misnomer. That generally they use a term like a temporary filling. So what exactly is this? I mean, if we have to explain and tell our patients what exactly these temporary fillings mean.
All right. So actually, the technical term used is intermediate restoration, which means it's like a stopgap arrangement. So sometimes when your filling is going through stages and it cannot be done on the same day, we use a certain material which we want it to stay in your tooth, protect your tooth, but we also want it to come out easily, because we don't want it to stay there for a very long time. Sometimes the tooth is slightly more decayed than normal, but it doesn't yet warrant a root canal. So then we want to try and see if we can save the tooth without actually having to go invasive and do a root canal. Then what we do is we put a layer of medication, okay, also contains some amount of calcium hydroxide, hydroxyapatite in it. There are different formulations available. Some are in flowable form, some are in powder and liquid form. A layer of that is put, and then we give you an intermediate restoration, which has to be slightly gentle on your tooth, so it doesn't exert too much pressure. And the idea being that you don't chew with all your might and force for that period of 2 to 3 weeks when we want the tooth to heal. It works very similar to, for example, if you have a sprain or a catch in your arm, and the doctor tells you don't lift anything heavy, just put a crepe bandage around it so that you're going to be careful, limit the movement. Imagine doing the same thing for a tooth. So the temporary filling is actually doing that job of the crepe bandage. So it's meant to last for a very short period. So people get very disappointed when it comes out. But I tell them, hey, look, the whole idea was that I wanted it to come out easily. So you may have to go back and get it, repatched.
Yeah. But I think it's also important that they should understand that these so-called temporary fillings have a very short life, and that they have to get back to their scheduled appointment, and not try to extend it, push it beyond that time, and then say, oh, you know what, the filling came out.
But Dr. Rekha, they're complimenting you. They're saying you've done such an amazing job that I didn't need to come back for the permanent. You can't do that, my dears, because that is porous. The temporary filling can be porous, so fluid can go down and irritate your tooth. So it's not meant to last for longer than your doctor tells you it is. So please go back when you're supposed to go and get it removed and get a permanent filling done ASAP.
Yes. I think that was pretty informative to our patients in trying to understand some basics about filling materials and the options that are available to them. Dr. Ranjani, thank you so much for taking time out of your schedule and telling our patients some information about filling materials.
Pleasure. It's always nice talking to you. Guys, if you like the video, please like it, subscribe, share. Yeah. Thank you for watching.
Sure. So I just hope I can get you back for another talk on another topic on oral and dental health to help our patients understand their dentists better.
Let's give them a clue. I think they should talk about night grinding and grinding of teeth. That sounds like a very interesting topic for our patients the next time around. So watch this space, guys. Very soon we'll be back.
Yeah, sure. Thank you. Sure. So, Dr. Ranjani, thank you so much for joining me today.
Pleasure.
Hello all. That was Dr. Ranjani Rao, who did talk to us about filling materials and your options available for your tooth restoration. Do visit our website www.thedentaire.com for more information about your oral and dental health, and do subscribe to our YouTube channel. Until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling and be happy. Thank you.